Hello family, welcome to another beautiful edition of Annie Author's channel. If today's your first day watching me, please hit the red button that says subscribe and you will be among the very first people that will be notified whenever I post something new. If you're a returning friend, well-wisher, subscriber, fan, thank you so much for coming back. I really appreciate and love you. Alright, so today's topic is menopause. Menopause for my child ladies. So just in case you're not in your 40s yet, you might know somebody who is in desperate need of this message. Maybe your relative, including your mom, and your neighbors, your friends, your well-wishers, your church members might be in desperate need of this information. Please do not forget to share with them. So like I mentioned, our topic of today is menopause. What is menopause? Menopause is the period that marks the non-existence of menstrual cycles in a lady's life. And this have to last for 12 consecutive months. So it's not like you will see your period this month, then you miss 2 months, then you say the third month, then you say you're no. It have to be 12 months in a row without your menstrual period. Then you can properly say, yes, I'm in my menopause. Okay. So again, during this time, what happens? The estrogen level in our system drops so fast. Some people, this can even start in their 30s. Okay, so that's why if you want to have kids, make sure you do that early, because you never know what's going to hit you along the way. All right, so this period mainly starts between the early 40s and 50s. Again, some people have experienced menopause in their 30s. So everything depends on your body mechanism and what comes your way, or maybe sickness or anything that might induce early menopause. We don't know, okay? But the average woman starts in her 40s. Okay, so when we say menopause, what really happens in your system? That means your ovary will stop producing egg every month. Okay, your estrogen level, which is the fertility or reproductive hormone, drops so rapidly. It drops so rapidly. So what happens when when all these things start taking place? That means your menstrual period will not be happening the way it should. So menopause is a normal pathway to aging for every healthy woman. So when it happens, embrace it with all happiness and seek remedy when applicable. All right, so what are the main signs and symptoms of menopause? Okay, so I will say number one is, because the first one is, at least you have to be in your 40s. Let's say, for example, 40s. I know, like I said, some people might be in their 30s, 40s to 50s. Then number two, there will be no menstrual period for 12 consecutive months. Then number three, hot flashes, which is like the biggie, the landmark of the whole thing, what women feel when this happens. Okay, so I will go back to hot flashes later. Okay, so I have mentioned 3 things that are the signs and symptoms of menopause. Okay, so what are the causes of menopause? Aging, 40s to 50. Like I said, is a normal pathway to aging for every healthy woman. So you have to be in that age group to be able to know this is actually menopause. And for the 12 consecutive non-existence of your menstrual period will mark menopause. All right, number two, surgical removal of your ovaries. Okay, so this might happen due to sickness or other things that might come your way, and the doctor will surgically remove the ovaries. That means the estrogen will not be in your system anymore unless it have to be replaced. So that will also be as a sign of menopause, as one of the things that causes menopause. Okay, removal of your ovaries. Then another thing is chemo and radiation therapies. All right, for people who have cancer, you know, the treatments might be chemotherapy, radiation, and all these things will hinder your monthly blood flow, your menses. Okay, and I have seen people who resumed their menses after the chemo or radiation. After a while, everything comes back to normal. But again, this can mimic menopause, and this can also cause early menopause because you're passing through those treatments. Okay, then number 4, primary ovarian insufficiency. So when we say primary ovarian insufficiency, that means your ovary naturally doesn't produce enough estrogen. Okay, so when this happens, this will push you further closer to menopause and faster to menopause. So along the way, this type of people that have this insufficiency in their estrogen level, that means they always experience inability to conceive because their fertility, so estrogen is the fertility hormone in women. So when the level is low, you're going to have difficulty getting pregnant. So that's why when all these things are happening, it's good for you to see your doctor so that they can run so many tests on you to know where to help you and where your problem is coming from. So don't just assume, it will come when God says it will come. But at some point, you have to seek medical advice because God created doctors and nurse practitioners and physician assistants to be able to help you. I would say genetic disorder, something like low number of follicles, autoimmune diseases, metabolic disorder, toxins like cigarette smoking or maybe secondhand smoking. That means somebody is smoking and you're breathing it. It's called secondhand smoking. So again, another thing might be something like chemicals. If you use a lot of pesticides in your house, all these chemicals you spray here, you spray there, and you are breathing, and these are toxins, and they can make your hormone level to drop really, really fast, and you'll be feeling like this will induce early menopause in you. So be careful when you spray things in your house and how you breathe it. Yes, all those things are inhalants that will also hurt your system. All right, so let's go back to hot flashes, which is a biggie when it comes to menopause. I had some women in their 30s, you see them, I'm hot, I'm hot, I'm hot. I'm not saying that whenever you're feeling heat is menopause, no. Because back in the days when my mom was much more younger, you see them using their wrapper to find themselves, or they're using this local fan to find themselves. So now I'm like, okay, probably they were experiencing menopause, but we didn't know. So at that time, you see that woman feeling so hot all of a sudden, and these hot flashes, this is like a warmth feeling inside, and it runs from your head all the way to your toes. This woman is just so restless, so uncomfortable, so irritated. Okay, so this is a sign of hot flash. Then another thing, there'll be profuse sweating. You see the woman sweating from head to toe, the armpit area, everywhere. They're just their faces, you see everywhere, just all filled with sweat. Okay, then another thing is a rapid heartbeat. Because of the heat inside, that will generate the heartbeat to go a little faster, which we call tachycardia. So your heart will be beating. Even when you put your hand on their chest, you will hear the heartbeat just boom, 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 going faster than ever. Okay, that's over 100 beats per minute. We call it tachycardia. All right, so another thing, you will see that woman sometimes losing hair. You comb your hair, you look at the comb, you see so much hair on the comb. That means that's part of hot flashes. Those are the symptoms. Then another thing you can see, the woman is anxious, there is anxiety, the woman is irritated. Even some women, it's not their making, it's how they are feeling. And a lot of us struggle with this. And another thing, surprisingly, you can see the same woman telling you, I'm hot, I'm hot, I'm hot. Before you know it, she will tell you, I'm cold, I'm cold, I'm cold. Chai, please bear with us. It's not easy with us. It's not easy to be a woman, honestly. Some men say it's not easy to be a man, but it's harder to be a woman, trust me. So when this happens, please bear with us, husbands, spouses, and friends, partners, please bear with us. So again, this can last for 10 good years, 10 good years of misery. It's not easy. It's not easy, especially if you're living in an environment where you cannot control the heat. There's no AC. Even when you have fan, if the air inside the house is hot, it's going to be blowing the same hot air to you. So again, these are the things that happen to women. Please bear with us when this happened to us. And some of us have difficulty sleeping because of the heat. If you're feeling so hot, it's hard for you to sleep. And when somebody is experiencing difficulty sleeping, it's called insomnia. Okay, so again, what are the treatments to hot flashes or the remedies to hot flashes? The first one I would say is hormone replacement therapy. Okay, so this is medical treatment which a lot of people might not be able to afford. That means the doctor will give you extra, that's estrogen to take. It can be orally, it can be injection, it can be vaginal, depending on how you and your doctor decides to take the estrogen. So dress lightly. Okay, this is not the time to wear turtleneck, long sleeve, wrap around, and all those things. Dress very, very lightly, otherwise you'll be out there throwing everything out. Okay, so that's why we need to be careful how we dress when we have reached that menopausal age. And also drink a lot of cold water and cold healthy beverages. This will help to keep your system cold. And also, if you can carry hand fan. I have seen some Nigerian women with their battery hand fan doing all that. Don't think it's fancy, or sometimes it's not just doing all this shakara thing. Some of them are actually burning from the inside, and that's the only way they can help themselves. Back in my mom's time, they have this hand fan. You know, we call it a coupe. Okay, so they were using it to fan themselves, but these days these women are carrying, you know, a little hand fan, battery operated, and they are doing all that. Yes, some of them are burning. Don't think na shakara. They are burning from the inside. So another thing I will tell you to do is to also avoid triggers. What I mean by triggers: drinking hot food or hot drink. Okay, so drinking coffee, tea when you're already feeling so warm, it's not advisable. Okay, so make sure you watch yourself before you drink whatever you are drinking. And eating hot spicy food is not advisable, because all these things will trigger the heat again from the inside, and it's not going to be funny. It's not going to be pretty at all. Then another thing is to make sure wherever you go that you're closer to a place that is cold. Okay, if you're under the sun, don't stay there for a long time, because it's going to cost you. Unless you have no choice, then you bear with the environment. Then another thing I would say, avoid stress. Avoid stress. Okay, so also practice comfort exercises, something like take a deep breath and breathe out so calmly and slowly. And you can also do yoga exercise. You know, yoga exercise, you sit in a very quiet place, you concentrate on your innermost thinking, you just try to forget all about the stress out there, you just relax. Okay, all right, so another thing I will also tell you, if you're a little chubby, overweight, try to lose weight, because losing weight alone makes you feel better and healthy from the inside out. Okay, and also you can also take estrogen, food that are high in estrogen, that's dietary supplements, something like soybeans, or maybe food that are high in vitamin E and fiber and iron. So take beans and fruits and veggies. All those things are always good to your system. And again, the biggie among all of these things is getting a loving, tender care from your spouse or your partner. Please, husbands, please bear with us. All we need mostly from you is your support, emotional support. If you need to massage our feet, please do. If you need to fan us, please do. If you need to bring us cold drink, please do. If you need to make sure that the room is cold for us, please do. Even when the room is too cold for you, please bear with us. That's the way we feel from the inside. It's not our making. It's not us that decided to feel that way. It's just what nature gave to us as women. So again, all we need from our spouses, our partners, is loving, tender care. Please, if that's the only thing you can do for us, do and support us. Thank you so much for listening to another beautiful edition of Annie Otto's channel. Please share with your friends, well, with your neighbors, your mom, your colleague, and this will really, really help someone somewhere. And men are not left out. Please listen and know how to help us best. Bye, guys.